Welcome to Navigating Freedom in Federal Retirement, the beacon for federal employees navigating the complex waters of retirement planning. We recognize your unique challenges, deciphering intricate policies and optimizing your benefits. Your host is Jeff Gill, a seasoned financial wealth advisor committed to demystifying this journey for you. Our strength? A team of renowned specialists, policy experts, financial strategists, healthcare consultants, and more. Each episode aims to transform confusion into clarity, offering actionable insights and strategies. Federal employees, it's time to turn apprehension into action. The path to a confident retirement starts here. Let's dive in.
Welcome to the show. I'm joined today by Drew Friedman. Drew is a news network reporter covering federal workforce and federal pay and benefits. She writes daily news articles and reports on the radio multiple times per week on topics directly impacting federal employees. Drew grew up in the D.C. area and has a bachelor's degree in media studies from the University of Virginia. Before joining FNN, Drew worked as a producer for the local news program Government Matters and as a production assistant for the local ABC 7 TV news station in D.C. Welcome to the show, and what an honor it is having you.
Thanks so much, Jeff, for having me. I appreciate it.
Yeah. We'll just jump right into it, Drew. Just wanted to ask you, can you provide any overview for the cost of living adjustments that are significant for the federal retirees or the Social Security beneficiaries?
Absolutely. And I can give you a little bit of context here as well, Jeff. So the cost of living adjustment, or as most people refer to it, COLA for short, this is a yearly annual percentage that's added to Social Security benefits as well as federal retirement annuities every year. That's been the case since 1975. Every year, there's been this automatic COLA that is added to those annuities and Social Security benefits to try to help keep pace with inflation, right? So that is what happens every year. For 2024, what we're going to see coming up in January is a 3.2% COLA. And that is, again, based on inflation data, and it's going to help federal retirees and other Social Security beneficiaries keep pace with inflation. There's a bit of a difference there in the percentage that you get based on the federal retirement system that you're in, but the top line number that the Social Security Administration announced was that 3.2% mark.
Okay, great. Drew, could you enlighten us on what factors are involved in determining the annual COLA increase?
No, that's a great question. And, it's based, as I said, it's based on inflation generally, but if you want to get a little bit more specific than that, it's based on the CPIW. This is an inflation index that is measured by the Bureau of Labor Statistics, and it looks specifically at families living in urban areas and represents about a third of the total U.S. population. So this is something that is measured every single month of the year. And based on whatever the percentage is, then the Social Security Administration will take the numbers from July, August, and September each year and create an average of those to determine what the COLA will be for the following year. So those 3 months, July, August, September, they average that out and they announce it. Usually you see that announcement come about mid-October from the Social Security Administration, and then that's implemented in January for federal retirees and Social Security annuitants.
Okay. Great. So is there any certain triggering information that determines whether or not a retiree receives full COLA adjustment or partial?
Absolutely. And that's something that I referred to a little bit earlier, but I'm happy to go into a little bit more detail here. So there is quite a history for the federal retirement system and how that operates. So if you look prior to about 1987, you had the Civil Service Retirement System. You can call it CSRS or FERS. It's referred to as both. This is something that began all the way back in 1920. So even outdates the Social Security program itself. This is the retirement program that older federal employees have been on and were on up until about, as I said, 1987. That's the time that Congress switched the retirement system to what we currently have for the federal workforce called the Federal Employees Retirement System, or FERS, FERS. So between those two systems, you have a different calculation and different things that retirees from the government receive. So with CSRS, they get the CSRS annuity, and they get often reduced Social Security adjustments, but they do often get Social Security. In the FERS category, FERS retirees have a three-pronged approach to retirement. So you have your FERS annuity, you have Social Security, and you have the thrift savings plan plus a government matching contribution. So those are the two systems. Anyone who retires after the 80s gets put into the FERS system. Now, what this means in terms of the COLA is that FERS retirees, when that whole program started, it was determined that they would receive a reduced, or often referred to as diet COLA. And what this does is, it based on how big the COLA is each year, FERS retirees get a little bit less. So CSRS or CSRS retirees get that 3.2% COLA added to their retirement annuity. But on the other hand, FERS retirees in 2024 will see a 2.2% COLA. So that's kind of the breakdown there and the history of those two systems.
All right. Well, thank you. Thank you for that. May I ask you, what advice would you give a federal employee when approaching retirement, for those early stages of retirement, in particular to planning for the COLA adjustments?
Right. So this is something that you should be keeping in mind. Of course, if you are a federal employee looking to retire, there is some specifics into the time that you retire and the time that you begin taking Social Security. There is a little bit of a difference there. So, for example, I believe if you retire prior to turning 62, then you would get eventually the full Social Security adjustment once you turn 62. But if you start taking Social Security before you retire, then that kind of affects the annuity or that you get. So there is something to be said for, looking into that a little bit more specifically and paying attention to the age that you retire. But yeah, generally that is just something that you want to keep in mind.
Okay. Very good. Thank you. Are there any other updates or changes that may be coming down the pike for retirement benefits or Social Security that retirees should be keep in mind or be aware of?
Absolutely. If you look at Capitol Hill, there's actually a couple things going on there. So specifically, if we're talking more about the COLA here, there's two different bills that would change how the COLA operates, both for federal annuitants as well as all Social Security recipients. So the first is called the Equal COLA Act. This is something that has been reintroduced every year since about 2018. It's gaining a little bit of traction in Congress, but so far has not passed, so it's not enacted. But this bill, if it were enacted, would give FERS retirees the full COLA amount each year. So again, as I mentioned, there is that separation. You have a 1% decrease for FERS retirees in their COLA amounts for their annuities. And again, that depends on how big the COLA is each year. So this bill would essentially make FERS annuities equal with CSRS annuities. This is something that we've heard a lot of federal organizations, federal unions really voice support for the enactment of that legislation. Again, it's not for sure, it's not official, but it is something that we are seeing potentially a little bit more traction there as well. There is a second bill in Congress too that would change the way that the COLA is calculated overall. So this is something called the Fair COLA for Seniors Act. This was reintroduced. This is a similar one where you've seen it reintroduced several years in a row. And this year it was reintroduced in February. This would change the way that the Social Security Administration calculates the COLA. So right now, as I mentioned earlier, Jeff, it is calculated based on the CPIW, which looks at those living and working in urban areas. The bill, if it were enacted, would change it to be based on the CPIE, which the E there stands for elderly. So this places a lot more emphasis on the costs, healthcare costs, cost of medication. And this tracks a lot more closely with what Social Security recipients, federal retirees, how they're spending works each year. So that's the basis for that bill. They're saying, if people who are retired are wanting, or this is how they're spending their money, then it only makes sense that the COLA each year is based on or tracks more closely to their spending habits. So again, this is something where it's an idea in Congress. It's not enacted, but it's something where we maybe are seeing a little bit more traction growing over time. And again, this is one that gains a lot of support from stakeholders like organizations that support federal retirees. And they say, this just simply makes sense. You add more weight to the cost of healthcare when determining COLAs for the country's senior citizens.
Excellent. Thank you, Drew. Where can individuals go to stay up to breast on the COLA changes that are coming down the pike?
So the main source of information, I would say, is definitely the Social Security Administration's website. They have a ton of information, the history of the COLAs going back all the way to the 70s or even before that. And they have, a lot of data. They explain all of this. They break it down, like how the COLA is calculated, what information they take in, and just really lay it out there for anyone who's interested in how this all works. I also will just do a plug for Federal News Network. That is my news outlet, and I cover a lot of this stuff. So our website is federalnewsnetwork.com, and we cover a lot of pay and benefits information specifically for federal employees and federal retirees.
Is there anything else that you believe our podcast listeners should know about the COLA adjustments?
Yeah, absolutely. I think we didn't quite dive into the recent history of how much the COLAs are. So, while we are seeing a 3.2% adjustment for 2024, there were, some other really big COLAs recently. So just for 2023, there was an 8.7% COLA, which was huge. That's the biggest one that we've seen since, I believe, the 1980s. So over 40 years, we have not seen that high of COLA. The year before, the 2022 COLA was 5.9%. So we've seen these really big COLAs compared with, if you look about a decade ago, COLAs were around 1%, 0%. So there's a very big difference here. And I would say, Jeff, that this only makes the supporters of the legislation that I mentioned even more vocal. Every year that you have the COLA added, especially if it's a bigger COLA, that means FERS retirees are continuing to get less added to their annuities compared to what they will get with the full COLA, right? So having bigger COLAs means they're missing out on more money, and over time that can compound pretty significantly.
Definitely. Well, thank you, Drew. Can you discuss the implications of the increase in health insurance costs for federal employees and retirees in 2024?
Yeah, absolutely. So, switching gears a little bit here, healthcare, obviously that pairs very significantly with COLAs with retirement annuities and those adjustments that you see every year. Obviously, you have a lot of federal retirees in the Federal Employees Health Benefits or FEHB program, and this has its own adjustments every year, its own percentage increase every year, but maybe a less friendly way. There's always a premium increase every single year for the FEHB program. And this is the program where federal employees and retirees get their health benefits as well as their dental and vision benefits. So very, very important stuff. For 2024, we're going to see an average of a 7.7% increase in premiums that the FEHB participants will be paying each month or each pay period towards those health insurance costs. So we, again, like I kind of mentioned with the COLA, where we've seen a lot of big ones over the past couple of years, in FEHB, we're also having some pretty significant percentage increases there. So 7.7%, quite significant. If you look even back to 2019, 2020, it was only 1 or 2% increase in premiums. And, last year we saw the biggest one for that with 8.7%. And Jeff, I will point out the interesting part here about, at least with the premium percentage increases, if you're looking for 2024 and you compare the COLA, so the amount that you get added to your annuity, 3.2% or 2.2% versus 7.7%. That's pretty different. But if you were looking for 2023 for this year, both of those were at 8.7%. So you're seeing a bit of a difference in premiums going up still pretty significantly. COLA a little bit smaller, whereas last year, or for this year, we saw those numbers pretty equal. So that is something definitely to keep in mind. And we are just, we're just about in open season time for the FEHB program as well here.
Yeah, just yesterday, one of my clients was discussing the increases in the health coverage and how it affects their fixed income. So, what do you have any suggestions for retirees and how they handle these increases or how they plan for them?
But yeah, Jeff, it's a great question. One thing I will say just right off the bat is that 7.7% is the average increase in health premiums, right? So that average is a key word. That means some programs, some carriers within the program are going to have higher premium increases. Some might have a little bit lower than 7.7% increase. So as we approach open season, we're going to have to, federal employees and retirees should be looking at what are the other health options that are available for 2024. And of course, open season is the time of the year that all FEHB program participants can make changes to their healthcare coverage for the following year. So during that about 1 month period, this year it runs from November 13th through December 11th. That's the time when federal employees and retirees should be taking a look at what else is out there, what is being offered, and maybe compare some different options in terms of, what are the coverages that you're getting versus how much it's going to cost. So that's definitely something that will be helpful for those who are concerned. Of course, the premium increase is going to happen. There's nothing that can be done about that. But in terms of what you can do specifically is take a look during open season and consider making a change if you see that there's going to be some cost savings there.
Very good. So if a retiree is looking to plan their budget for the next year, that open season, I guess, is a good time for them to, witness their new upcoming costs so that they can put it in their budget and plan forward. Is that correct?
Absolutely. And Jeff, something else that I'll mention here too is that not a lot of people take advantage of open season. If you look at the data that the Office of Personnel Management puts out, only about 5% of FEHB enrollees actually make a change during open season. So of everyone, the millions and millions of people in this program, only 5% make changes. So it doesn't necessarily mean, if you take a look and you decide, hey, I'm going to stick with what I have, it's the best choice for me, that is fine too. But it's definitely something where you see the Office of Personnel Management, you see a lot of different stakeholders and those who are trying to support or help retirees saying, hey, you should really take a look. There could be, you could be saving hundreds, if not thousands of dollars, depending on how you're looking at things and how you cut it.
Right. Are there any other specific retirement-related challenges or considerations that federal employees approaching retirement should be aware of, given the rising healthcare cost in the FEHB program?
No, absolutely. I think that's there's always considerations to make. There's a lot going on. Each year, OPM is the agency that runs the FEHB program. They always are adding new requirements for health insurance carriers, and they're changing the way things are covered in the program. So it's really important to take a look. Specifically for retirees or those approaching retirement, you might want to look at Medicare and think about that as well. So specifically, I think there are some changes coming up with Medicare Part D. This is the section of Medicare that involves prescription drug coverages. And with that, have been some changes since last summer with the Inflation Reduction Act. So that's something where federal retirees or those who qualify for Medicare should be taking a look as well. You're seeing a lot more FEHB carriers offering Medicare Part D. And in terms of the Inflation Reduction Act, there were some changes that were enacted. So specifically, the legislation that billed the Inflation Reduction Act prevents Part D premiums from increasing more than 6% in every year. So that premium cap, you will see that every year through 2030. So that's pretty significant because, those numbers can go up, as we said, whereas we were talking about a little bit earlier, 7.7% premium increase on average for FEHB premiums. If you see this cap at 6% for Medicare Part D, that is quite significant there as well. And they're also part of the Inflation Reduction Act. Another recent change is a $2,000 cap on out-of-pocket spending for enrollees in Medicare Part D. So that basically means no one's ever going to be paying more than $170 per month on out-of-pocket prescription drugs. So, these changes that were part of that larger Inflation Reduction Act bill, those are going to be pretty significant. And to just look, so I would recommend just taking a look at some of those fine-tuned changes that are happening for Medicare Part D. Maybe consider that during open season this year for your healthcare in 2024.
Excellent, Drew. Thank you. So with the philosophy of the FEHB program being described as market-based and focused on the choice and competition, how does that tie into retirement planning, and what impact might it have with retirees' options?
It definitely has a significant impact. I think it is pretty standard to have a program like this be market-based. If you compare, for example, let me step back for a second and say that the FEHB program is the largest healthcare program in the world for under one employer, the federal government, right? So it is a huge, huge program. And if I actually did a little bit of a comparison with some other somewhat comparable programs for their premium increases. So the one specifically that I looked at was CalPERS. This is the health insurance program for California state government employees. Mm-hmm. Their premiums are going up around 10 or 11% on average. So that's quite significant compared with FEHB premiums. Now, I'm not saying 7.7% is, that's still quite significant, but it's something to consider that, these premium increases are not unique to just the FEHB program. Again, it's not necessarily, in anyone's control. OPM has their way for determining, those premium increases each year, and that's just going to be part of the program. So I would say, the best thing you can do is, use what's in your control, which is, again, taking a look during open season and thinking about what can I do to kind of balance out some of those rising costs. And of course, I understand, and we talked about this earlier, that you hear from a lot of retirees concerns about, inflation and all of these rising costs over the years. So it's certainly a big concern for federal retirees.
Excellent, Drew. Thank you. Can you share any resources or tools that are available for federal employees and retirees to help them better understand the plan and healthcare costs of retirement, especially in light of the premium rate increases?
Absolutely. I think where every federal employee and federal retiree should start is on OPM's website, opm.gov. You can go to their healthcare section, to the FEHB section, and they have this very helpful online tool called the Plan Comparison Tool. And what you can do is you put in your zip code, you can see what plans are available to you for the upcoming year, and then you can plug in, one or two different options and compare how much would this cost, how much would be taken out of my paycheck each time. So that's something that can be really, really helpful if you want to compare maybe what you have currently, your current options, and see how much those are going to be increasing versus maybe there's another carrier that's been on your mind that you want to consider or take a look. That's a really important thing as well. So the OPM Plan Comparison Tool. Other than that, I'll say again that Federal News Network, my reporting covers a lot of this. We have a radio program called Fed Life that talks a lot about this information. So we're following this very closely as well. And we're here to answer any questions, just as I'm sure you are, Jeff.
Right. Thank you. Well, given the changes in those premium rates and the number of plan choices, which you just stated where they can find some of those, and the carriers for 2024, what advice would you offer for retirees or with regarding their health insurance coverage decisions that they need to make in retirement or pre-planning for retirement?
It's a great question. I can't speak to very specific advice. Everyone's a little bit different, but again, top line advice is take advantage of open season. Only 5% of people do. So it's very important that you take a look. You should also be asking yourself questions like, are my medical needs changing next year? Are there certain doctors that I'm going to need to see more or less? Do I need to have different types of coverages? Because that's also, of course, something that can affect what type of plan you're enrolled in. So, if you're in one and you need some other coverage that isn't available in your current plan, it's very important to take a look and make sure, each plan is going to have their plan brochure to lay out what are the changes this year, what's available. So make sure to take a look at those as well. So that's what I would say, is just do your research and make the best choice for yourself.
Excellent. I want to thank you for joining us today, Drew. It's been a pleasure having you, and we'll see you again next week. And thank you for listening to Navigating Freedom in Federal Retirement. Thank you.
Thank you.
This concludes another episode of Navigating Freedom in Federal Retirement podcast. As federal employees, your retirement journey is unique, and we're here to guide you every step of the way. With host Jeff Gill and our lineup of experts, we aim to bring clarity to your path ahead. If you found value in today's conversation, please share it with a fellow federal employee. Remember to subscribe for continued insights. Until next time, here's to your informed and bright retirement future.